So life in the womb begins with the magical union of the egg released from the ovary and sperm. Formation of one cell baby, which divides and grows to form a fully formed baby in 9 months. Greetings, I am Dr. Anjali Taneja, consultant obs and gynae, Cloud9 Hospital, Patparganj. Congratulations, you have missed your period and done a pregnancy test. It's wonderful to see those two red lines in the kit, but it also brings a realization that from now on you need to be careful about your health. You're going to be a mother, you're going to be proud parents, you're proceeding with the family. A living being is created in you, and whatever you eat, you do, has an effect on it. So let's talk about common early pregnancy queries. So pregnancy is divided into 3 parts, which we call as trimester. So today we'll be basically talking about the first trimester. It starts from the first day of the last period you had. That is what we call as your last menstrual period, LMP, and lasts up till 13 weeks. This is the time when the formation of the body parts of the baby occurs. So it is important here to note that even before you missed your periods, the conception has occurred and the baby formation has already started. So it is important that when you're planning pregnancy, it is important to adopt a healthy lifestyle. Any uncontrolled medical condition, unsupervised medication, alcohol intake, smoking can cause detrimental effects, can cause abortion or birth defects in the baby around that time. So pre-pregnancy planning is an important component. It is good practice to start taking folic acid and get few preconceptional tests done when planning pregnancy to ensure that you and the baby are in the best of the health. Once tested positive, many people choose to wait कि अभी थोड़ा टाइम जाने देते फिर डॉक्टर को दिखाएंगे. But it's good to make an appointment as early as possible to ensure that the best care plan for you and your baby is being made so that you get the best healthcare facility available to you. So what happens when you visit to the doctor? At the first visit, the doctor is going to take your detailed history, ask your last menstrual period, the day 1 of it, any medicines that you have been taking, any other history which is relevant, will prescribe some medicines including folic acid and advise some blood test and an ultrasound to you. So this is what happens in the first visit. So now let's discuss some common symptoms of pregnancy which are perfectly normal but may be bothersome. So now what are they? A patient, a female who is pregnant in early pregnancy may end up feeling tired, lethargic, feeling sleepy. So it is perfectly normal. Why does this happen? It could be simply because a lot is going on inside your baby, inside your body. Though the baby bump is not visible right now, but your body is doing a lot of work. A whole new being is created inside your body. So it is normal to feel tired. It can be because of the anti-nausea medicines that you're getting. So it could be because of the hormonal changes of pregnancy. So it is okay to feel tired, sleepy, lethargic. Listen to your body. Take adequate rest. Remain stress free. Stay hydrated. Take plenty of oral liquids, which is very important. A lot of females have nausea and vomiting. They feel pukish. They are not able to eat much. They have food aversions. There is change of taste. So all these symptoms are again normal and they occur because of the pregnancy hormone HCG. Nausea and vomiting commonly occur in the 3 months of pregnancy. They are commonly called as morning sickness, though irrespective of this name, it can occur at any point of time in the day. It can occur in morning, afternoon, evening, any time. It can be bothersome. So how can you help yourself with this symptom? Try eating small, frequent meals. Eat smaller portions but eat frequently. The time when the sensation is more, avoid liquid intake at that time. Try to have more solid meals at that time. Ginger as a household remedy can help. Ginger tea, ginger lozenges, so it can be helpful. If required, you may be given anti-nausea, anti-vomiting pills also. In some very small proportion of females, the symptom can be so bothersome that they are just not able to eat anything. This is what we call as hyperemesis gravidarum, and this small proportion of females may require admission also. Some of you may be troubled with constipation. Again, this is a common and a normal symptom of early pregnancy. It can happen because the bowel movement slows down because of the pregnancy hormones and the changes which are occurring in the body. It can happen because of the medicines that are being given to you, decreased physical activity that happens in pregnancy. So all these things contribute to constipation. To help yourself, increase liquid intake in diet, do exercise, increase fiber intake, and few females, if required, can be given medication also. Another thing that bothers a lot of females is that I'm not gaining weight. In fact, in early pregnancy, in initial 3 months, you may end up losing weight, which is perfectly fine. The weight gain is typically going to start after 4th month. Small amount of weight may be lost in initial 3 months because of nausea, vomiting, decreased appetite, which is okay. Many females experience mood changes, breast tenderness. Some females experience a sensation of discomfort or a stretchy sensation in the lower abdomen. Again, this is normal. Unless it is gradually increasing, is painful, then it can be a sign of abnormal pregnancy. So do inform if you are experiencing constant discomfort or a gradually increasing discomfort or pain in your lower belly. Slight stretch or discomfort can happen in pregnancy because of the growing womb. Skin changes may happen. You may notice some pigmentation on your cheek, around breast, inner thighs. You may notice that your acne have suddenly cleared out, or there is a sudden outbreak of acne. Remember, anti-acne creams or pills which are available over the counter are not safe to use in pregnancy. So don't purchase any over the counter anti-acne cream and apply it unless you have consulted your doctor. Some females may experience increased frequency of passing urine. You may feel puffy and bloated also. Symptoms. So these were the normal symptoms that we have discussed as of now. Now there may be few symptoms which are not normal, and if they are happening, you must consult your doctor and you may need medical attention. So what are they? Any persistent or increasing pain in your tummy, especially down below. Any bleeding, as these two can be a sign of some problem with your pregnancy. Maybe an abnormal site of a pregnancy, which we call as ectopic pregnancy, or an impending miscarriage also. Burning or painful passage of urine. If you're passing urine too frequently but it is not painful to you, there is no burning associated with it, then it could simply be because of the early pregnancy symptom. But if it is painful, there is a lot of burning when you feel when you're passing urine, then it can be a sign of urine infection also. So do inform your doctor if you are experiencing such symptoms. Excessive vomiting with inability to eat. As I said, this can happen in small proportion of females, and this is the subgroup which may need medical attention. Leg or calf muscle pain with swelling in the leg. There is a medical condition which we call as deep venous thrombosis, in which clotting can happen in your calf muscles or legs, which will present clinically as pain in your legs with swelling. This condition can be serious, and if you are experiencing any such symptoms, do inform your doctor. Severe headache or fever again cannot be counted as normal. So now coming to some common queries that you may have during your initial pregnancy. So one of the queries is how to cope up with nausea and vomiting in first trimester. Right. So first, try to have more solid food around the time when the nausea and vomiting is more. Things which absorb saliva like bread which is roasted, a rusk may help. Ginger as a home remedy may help. Ginger lozenges are available. Ginger as a combination with a medicine is available. You may be given anti-nausea pills by your doctor. At some time, antiemetics can be required. If these measures are not working, as I said, you may need hospitalization, though that is required in a very, very small proportion of cases, maybe 2 patients out of 100. So, other common query is that why am I being given folic acid? Do I really need it? So yes, it is a routine supplement which is given in early pregnancy. It is given to all females. This is a small yellow colored tablet, and this vitamin is required for the development of spine, this head, this skull and spine of your baby. So do take this vitamin and don't miss it. Another thing is that what to eat, and do I need to eat for two? What is the best diet? So, while there is nothing like eating for two in pregnancy, but you definitely need to eat a bit more, because whatever you're eating, the energy and the nutrients from the food are going to be used by the body in the pregnancy to make the living being. So on average, you need an extra 400 calories a day. The amount may vary depending on if you are under or overweight. If the average weight gain that we suggest in pregnancy is around 7 to 15 kgs. So if you are underweight, a slightly higher calorie diet may be suggestible to you. If you are already on the higher side of weight, too much of weight gain may not be very good. Too much of weight gain can have its own negative consequences, like extra weight post pregnancy may be difficult to shed off. It can have consequences in terms of increasing your risk of medical problems in pregnancy. The risk of gestational diabetes, the kind of diabetes that comes up during pregnancy. It can increase your chances of having high BP in pregnancy. It can increase your chances of having a cesarean section. It can increase your chances of having DVT, the medical condition that we just discussed, the clots which develop in your legs. So all these risks increase with putting of too much of weight. So yes, you must eat sensibly. Your diet should be as far as home cooked fresh meals. A good strategy is to have frequent small meals, maybe 3 snacks and 3 major meals. Avoid too sugary or things which are high calorie, high sugar, low nutrient snacks should be avoided. Good options for snacking could be something like makhane, foxnuts, bhuna chana, peanuts. In winter, jaggery can be an option because it is a good source of iron. To increase your iron intake, you may like to include in your diet pomegranate, anjeer. Try cooking in iron utensils, green leafy vegetables. For calcium, dairy products, and then makhana is also a source of calcium. For protein, dairy products, soya, protein powders are supplemented in diet. Then peanuts are a source of protein. So these are your options in diet. Do try to include them in your diet, and then have at least 3 to 4 servings of fruits and vegetables. Drink plenty of water. Have fresh food as far as possible. Avoid outside food. We don't know the type of oil, the amount of oil, the kind of salt, the amount of salt that is included in the food which is outside. Occasionally, if you may choose to eat outside, try to have it from a hygienic place. Then what to do for heartburn? Heartburn again is a common problem during early pregnancy. You may try sipping peppermint helps. You can make peppermint water and try sipping it throughout the day. It should not be too strong as it can cause diarrhea also. आप सौंफ चबा सकते हैं. Otherwise, as a last remedy, again medicines can be prescribed safely in pregnancy even for heartburn. Doctor has prescribed folic acid and doxynate tablets. Are they sufficient? Yes. In an uncomplicated pregnancy, initial 3 months, folic acid and doxynate are sufficient. Further medication is given only on case-to-case basis if it is required. And are consumption of antacids safe for nausea and vomiting? Yes, few antacids are safe for nausea and vomiting in pregnancy. Depending on your case, your doctor will prescribe you that. If they are required, yes, they can be given. So this was about diet. With the festival season coming in, lot of us have a query, can I color my hair? So the chemicals in the permanent and the semi-permanent hair dyes are not highly toxic. Most research, although limited, shows it's safe to color your hair while pregnant. But the keyword here is the research is limited. So it is advisable that initial 3 months you may choose to go for indigo based or henna based color if you really wish to color your hair, and after that if you really want, you can use semi permanent hair color. If you are choosing to color your hair yourself, wear gloves, use it for a limited time. You may choose not to go for global coloring, use only streaking, and work in a well ventilated room, and keep it for as less duration as possible and rinse it off. Another very common query that we have is, doctor, can I travel? Can I travel by air? What is the safest time to travel? So in the absence of any obstetric or medical complications, obstetric is, that is, your pregnancy is uncomplicated. Medical means there are no pre-existing medical problem which has exacerbated in pregnancy, or no newly developed medical problem like hypertension or anything which has developed in pregnancy. Then yes, you can travel in pregnancy. Occasional air travel is safe for the woman, and the precautions will apply as for the general population otherwise. Then the other concern that arises is that will I pass through the security scanners and the radiation will be there? Is that okay? So yes, you can go through the security scanners. The amount of radiation used is very low and it is okay for your baby. It doesn't harm your baby. You can use seat belt, and it is good to use seat belt throughout the journey because turbulence can happen and your risk of fall can be there, which can harm the baby. So it is advisable to wear the seat belt throughout the journey, and wear the seat belt below your baby bump. Other precaution that you may choose to take while flying is that avoid consuming gas producing food just prior to travel, as the gas tends to expand on higher altitude and which can cause some discomfort while traveling. Stay hydrated and ambulate in between, which will keep you comfortable. Specific to early pregnancy, it is advisable that an ultrasound has been done before you travel, so that we know that the baby's heartbeat has come and the baby's location is normal. So we have ruled out the miscarriage and ectopic largely to extent before you are traveling, to avoid any mid-air crisis. Again, traveling can have some airline specific requirements, so you need to check with the airline before traveling for any such requirement. So another very common query that we have is, doctor, can I have sex during pregnancy? Yes, if you are physically and emotionally comfortable, you can have, unless you have been told specifically by your caregiver not to have it. Can I exercise, and what form of exercise is safe for me? Can I do yoga? Can I do aerobics? Yes, regular exercise is safe and beneficial in pregnancy unless there is high risk and you have been told not to exercise. Otherwise, exercise is safe for you, and in fact, it decreases the risk of medical complications in pregnancy. It reduces back pain. It reduces the risk of having constipation, controls weight gain, improves sleep, mood. So you must check with your doctor to make sure that your exercise routine is safe and to decrease all these risks in pregnancy. So how much should I exercise? Try to aim for around 150 minutes a week. Sounds too much? No, it is not. It actually translates to around 30 minutes a day for 5 days a week. तो आधा घंटा हफ्ते में 5 दिन, बहुत ज़्यादा नहीं है. That will come to 150 minutes a week. मैं क्या एक्सरसाइज कर सकती हूँ और मुझे कब रुक जाना है? So learn to listen to your body. You have to stay well hydrated. You should not get breathless or overheated. If you are comfortable, आप अपने साथ वाले इंसान से comfortably बात कर पा रहे हैं, आपको कोई सांस नहीं फूल रहा, आपको कोई unusual pain नहीं हो रही, discomfort नहीं हो रहा, then you are good to go. डॉक्टर ने कहा आधा घंटा एक्सरसाइज करो रोज़ का, लेकिन मैं 15 मिनट में मेरा सांस फूलने लग जाता है, देन स्टॉप. ग्रेजुअली बिल्ड अप योर स्टैमिना एंड ग्रेजुअली इंक्रीज. In this 30 minutes, you can include walking, you can include yoga, you can include Pilates. These are all safe modes of exercise. Anything that puts too much stress on your joints has to be avoided. Otherwise, exercising is safe. Again, if you are starting exercising for the first time in pregnancy, which a lot of females do, then it is a good practice to build it up slowly and increase the kind and complexity of exercise under supervision of a trainer gradually. So don't do it all by yourself or simply by watching videos. Do it gradually, and in any case you can simply start with a simple basic walking, which is anyways beneficial. So how much weight gain is okay in pregnancy? So around 7 to 15 kgs is okay. Will the color of my baby be dependent on the food I eat? No, the color of your baby is not dependent on the food you eat. It is decided by the color gene that you and your partner gave to the baby when the moment the baby was conceived. That is when we spoke of the egg and the sperm combined to give rise to the baby. It is that moment the genes were transferred and the color of the baby was decided. So color of the baby is to do nothing with the kind or the color of the food that you are eating. What is the best sleeping position? So there are some studies which say that sleeping on your back may not be very safe, especially after the 4th month, because it may cause compression of the great vessels of the body, compromising the blood supply to your baby. So it is a good idea to sleep on the sides, right or left, preferably on the left, in which position the baby gets a better blood supply. Can I eat fish in pregnancy? Okay, so fish, the source of the fish is basically water. So there are hard water fish and there are soft water fish. The hard water fish specifically can be contaminated with mercury, which is a metal linked with birth defects. So avoid shark, swordfish, marlin. Do not eat raw fish. Limit your fish intake to maybe twice a week, and don't overdo it. Can I take alcohol? No amount of alcohol is considered safe in pregnancy. There is nothing like thoda sa le liya tha. No amount of alcohol is safe. It can cause emotional, behavioral, mental problems in the baby, which may last lifelong also. So absolute no to alcohol. Another question, can I take tea or coffee? So majority of us do take tea and coffee. So it's a very very common thing that मेरे को छोटा सा चाहिए होता है, नहीं तो मुझे headache हो जाता है, नहीं तो मुझे problem होती है. So the idea is that we have to understand how much can we take. The daily limit of caffeine that we can take is around 200 milligram per day, but then how to measure it? Also, we have to remember that caffeine is present not only in coffee, it is present also in green tea, dark chocolates, many soft drinks also. So a good idea may be to limit yourself to a small cup daily. I am not gaining weight in first trimester. So as we just discussed, weight gain typically starts after first trimester. It is okay if you are not gaining weight up till 12-13 weeks. You may actually end up losing a bit of weight, which is okay. Okay. So what are the don'ts in early pregnancy? So till now we have covered what are the normal symptoms, we have covered what are the symptoms which require medical attention. We have covered what a few queries. Now we come to the don'ts, the things which we are not supposed to do in early pregnancy. So avoid any self medication. Remember, we just discussed that this is the time when the baby is forming, and after that the baby grows. So when the formation is occurring, anything that we take is going to affect the formation of the baby. So do not self medicate, as anything that is consumed around this time may harm your child. Avoid raw uncooked food, as it can transmit infections to your baby. If you are a pet lover and have a cat at home, you should not be cleaning cat litter. It can transmit infections which can be transmitted from pregnant female to the baby, and they can be harmful for the baby. No smoking, no alcohol, and no over the counter anti-acne creams. Okay, so how many visits to doctor do I need during my pregnancy? So routine antenatal checkup occurs usually once a month till 28 weeks, and then twice a month from 28 to 36 weeks, and after that monthly till your delivery. However, the frequency may change depending from case to case. At times you may be called more frequently depending on how your pregnancy is going. So what to do for itching in whole body? Okay, so itching is very common in early pregnancy, and early pregnancy 17%, 17 females out of 100 may complain of itching. Your doctor may choose to get your liver function test done, and you may apply lactocalamine lotion. However, if this itching occurs in the later part of the pregnancy, it can have different consequences, and your doctor will need to discuss with you regarding that. Because we are discussing today about early pregnancy, so if you are talking of pregnancy with itching in early pregnancy, so just apply lactocalamine and you should be okay. So is yoga safe in pregnancy? Yes, you can. What are prenatal vitamins? So as a prenatal vitamin, we give vitamin folic acid primarily, and then if you're deficient on hemoglobin or you're deficient in vitamin D, other vitamins can be supplemented. Is it safe to have sex during pregnancy? We have already covered that. Yes, if you are not specifically told by your doctor to avoid it, you can have sex during pregnancy. What are the signs of an abnormal pregnancy? Okay, so abnormal pregnancy is a very broad term. Abnormal pregnancy could be abnormal in terms of that your pregnancy is not growing, it is growing, it may end up with a miscarriage. Abnormal pregnancy could be because the location of the pregnancy is not okay, it is not at the abnormal, it is at the abnormal site, which we call it ectopic pregnancy. So usually in early pregnancy, abnormal pregnancies will present either with some kind of bleeding, spotting, pain abdomen. So these are the usual signs. Is protein powder necessary? I am having limited protein food daily due to excessive vomiting, but weight is not reducing in normal range. Is protein powder? Protein powders are generally not started in initial 3 months. They are started afterwards. See, protein requirement in pregnancy will depend on your body weight. It is usually around 1.5 grams per kg body weight. So if you think you are able to meet this requirement with your diet, you may choose not to take supplement. But if you are a pure vegetarian or you are not able to take this much protein in your diet, then it is a good idea to supplement your diet with protein, because otherwise the baby and you yourself will have deficiency. What are the good signs of a healthy pregnancy? Okay, so in early pregnancy you may have normal symptoms as we just elaborated, but there is no significant pain, no bleeding. Ultrasound done around 7 weeks shows that the baby's heartbeat is there, the baby is growing normally, and the location is fine. And gradually after 12 weeks your appetite comes back to normal, you're eating well, your BP is okay, The tests which have been done, the scan which have been done are normal. How can I avoid miscarriage? Okay. See, many times the conception is that first trimester is risky. So, what can we do to avoid miscarriage? Shall I go on bed rest? Can I climb stairs? Can I do my household activity? So, we have to understand that this statement may be partially true, partially not true. It is not exactly that first trimester is risky, but majority of the pregnancies which go through first trimester will continue till end uh, and end with a live birth. So it's a nature's law. If there are 100 pregnancies occurring, few will abort because of some problem which occurred at the time of conception maybe. So there is nothing that you can do about it. But as such, the pregnancy is robust and you're carrying out your daily activities, or you're eating, you're climbing stair, uh, is not going to harm your child. So you don't need to be on absolute bed rest unless you have been specified by your doctor for some reason. So you can carry out your day-to-day activities as you were doing it, but do inform if you have any medical condition so that it is properly controlled. Do not take any unsupervised medication and avoid alcohol and smoking, and do not do the don'ts. Which trimester is most important? Well, every trimester has its own importance. The baby continues to grow and ultimately we have to have a live birth term baby. So in first trimester we have already discussed. In the second trimester from 13 to 28 week the baby continues to grow, and from 28 week onwards the baby gains weight and the body prepares itself for the birth of the child. What week do most miscarriages happen? Most miscarriages will happen around early pregnancy, 7-8 weeks. Once the heartbeat has come, majority of the pregnancies will continue. How should you sleep in the first 3 months of pregnancy? The best sleeping position is to the sides, left or right, left preferably, but the advice is particularly valid after the 3rd month. What are a few signs of pregnancy? The very first sign is missed periods. So if you have been having regular periods and now you have missed your periods, do a pregnancy test. Do it with the morning urine, the first urine that you have, and the kits are commonly available in the market. If you see 2 lines, you are pregnant, and congratulations. Ma'am, I'm 18 weeks. When can I feel my fetal movements? Okay. So if it's your first pregnancy, you may feel fetal movements slightly later, maybe around 20 weeks. In your second pregnancies, the movement may be felt slightly earlier, maybe around 16 to 18 weeks also. But in any case, whether it is your first pregnancy or second pregnancy, you must feel fetal movements by 24 weeks. If you have not felt the fetal movements by 24 weeks, then it is a matter of concern and you should inform your doctor. Which urine is best for pregnancy tests? So the first urine in the morning when you get up, because the hormone, the same pregnancy hormone, it is concentrated in that urine overnight, is the best urine. So that is the urine you should be using. Which sleeping position can cause miscarriage? No, sleeping position cannot cause miscarriage. Don't worry. Which fruit is good for pregnancy? So try to go for good seasonal fruits. There is a myth that papaya can cause miscarriage, so you may choose to avoid it. Any seasonal fruit is good. What blood tests are done when pregnant? Okay. So when you visit your doctor at the first visit, you will be advised to do blood tests, which will include your blood group, basic hemoglobin. These are done for you, that you are in the best of health when you are conceiving and you are not anemic. Then tests like urine microscopy, urine culture, tests for few infections which include rubella, viral markers, and tests for syphilis. These tests are done so that we know that there are no infections which can be transmitted from the mother to the baby. Then the test done is thyroid and sugar, so that again the baby's development is not affected by the maternal sugar or maternal thyroid levels. These are the tests which are advised at the initial visit. Then an ultrasound is advised to check for the heartbeat in the baby, and after that around 12 weeks you are advised screening for the aneuploidies. Ma'am, should I worry if I have been trying to get pregnant but can't I? Okay, that depends on your age and for how long have you been trying to get pregnant. If your age is more than 30 and you have been trying for more than 6 months, yes, you should see your doctor. If your age is less than 30 and you have been trying for an year, you must see your doctor. Ma'am, my double marker test. A dual marker report has to be seen in toto. So we cannot just comment on the PAPE value. What to do BP patient during pregnancy? So BP patient, if your BP patient during pregnancy or your BP has been high prior to pregnancy also, if you can clarify this to me, what to do BP patient during pregnancy? See, if your BP has been high even when you were planning pregnancy, that is prior to pregnancy, or you have been diagnosed BP patient at less than 20 weeks of pregnancy, then you will be advised few tests to see that this BP has not harmed you as a mother. So you will be advised a baseline CBC, kidney function test, liver function test, maybe an ECG, a test to check for your eyes, and few tests to see why your BP is high as a young patient. You're a young, mothers are generally young, so in a young person why is the BP high? So there will be few tests to see that. And then BP monitoring will be advised. You will be put on a restricted salt diet, and at a certain cutoff of BP you may be advised medication also. Now this will be for the mother. For the baby, we need to see that the high BP is not affecting the baby, so you may be started on a medicine called as ecosprin, and then the blood flows to the baby will be checked. The frequency of which will depend on the condition of the baby and the BP. It could be 2 weekly, it could be 4 weekly, starting 26 weeks during pregnancy. How many weeks are you? What to do BP during pregnancy? During pregnancy, how many weeks are you? Okay, so basically for you it will be BP monitoring, salt restricted diet, putting you on ecosprin, monitoring that BP has not harmed you, and for some tests for the cause of the BP, and then fetal monitoring. I have had breast implants, can I still breastfeed my baby? Well, that depends why were the breast implantation done and where are the incisions. So if the breast implants have been done so that the incision are down below or in the axilla, that is the ducts, the milk ducts have not been cut or the nerves around them have not been injured, you can still actually breastfeed the baby. Coming back to the BP query, you are 17 weeks. So at around 17 weeks, you must be taking ecosprin, and again, so that is basically chronic hypertension. That is you are hypertensive prior to pregnancy, or you have been diagnosed having hypertension in early pregnancy. So you will be put on BP monitoring. Some tests will be done for you as I have just elaborated, and to see that they have not harmed you, ultrasound of your kidneys, eyes checkup, and a baseline ECG, to urine test to check for any protein secretion in your urine. The frequency of repeating this test will depend on your BP and your condition, and the test for baby level 2 ultrasound will be advised to you around 19 weeks, and then further monitoring for the baby will start around 26 weeks. How long should I be allowed to go past my due date? You may be allowed to go till 41 weeks, but that is with monitoring, and that depends from case to case. If you have some problem in pregnancy, you are having high BP or having diabetes, then you may not be allowed. If it's a totally uncomplicated pregnancy, then you may be allowed, but with the stringent monitoring, because going past your due date also has its risk. Is normal delivery possible if mother has a slip disc? Wow, that's an interesting question. So if mother has a slip disc, there is a very limited number of studies regarding this. There's no definitive answer to it. So if the slip disc is in the lower back, where the stress of labor can happen, then it may be more advisable for you to undergo a cesarean section. I am 29 weeks pregnant and scans showed that there is less water around the baby. I am also a thyroid patient. Will this affect the baby? Okay. So for thyroid you must be taking medicine already and it should have been controlled by now or on way to control. So thyroid doesn't affect your water level, and if you're 29 weeks and the water level is less, first we have to see what is the cause, why the water level is less. Is your BP okay? Then we need to see the any history of leaking. Water has not leaked away. Then we have to see the baby's condition. The growth of the baby, does it corresponds to 29 weeks? How are the blood flows to the baby? And depending on all this, the plan for the baby will be made. I am 3 months pregnant. My doctor suggested me to take NIPT test. Is it important? Okay. NIPT is non-invasive prenatal testing. So, as we just mentioned about the testing in pregnancy, when you reach around 12 weeks, there are tests which are advised for screening of some genetic syndromes in your baby. Aneuploidy screening, which is trisomy 21, 18 and 13, which we commonly call as Down syndrome screening, which is trisomy 21. So normally what we advise is a test called as NTNB scan and a dual marker, which I am sure many of you who have reached 12 weeks or just crossed 12 weeks would have been advised. NTNB is a special scan in which the thickness of the nape of the neck of the fetus is measured and nasal bone presence is seen and a few other things are seen. This scan is ideally done by a fetal medicine specialist. The report of this scan goes to the lab. The lab takes blood sample from the mother and then a report comes which gives us a risk. Now the important thing here to understand is that the test is not diagnostic. It is giving us the risk. The risk of what? When the baby is formed, half the genes of the mother, half the genes of the baby have come from the mother and half the genes of the baby have come from the father. So 23 genes from the mother, 23 genes from the father, making it a total of 46 in the normal human being. Sometimes there is a error at the level of nature and an extra gene may pass. So something which should have been twice, which have been 2, is now 3. So the name is trisomy 21, 18 or 13. The 21, 18 and 13, they signify the number of gene which has come. So these babies are different from other babies in terms that they can be different in their appearance. They can have somewhat lower IQ. They can have heart problems. So we are basically screening the baby for the possibility of these syndromes. If the baseline risk of the mother is low, that is mother is less than 35 years of age, there is no family history of such babies, there is no history of recurrent abortions, then dual marker and a NTNB scan is suggested. The combined report gives us a risk and the report is around 85-90% accurate. What is meant is that if the report says that the risk is low, the chances that the baby will not have Down syndrome is low. So the chances, it is not saying the baby will not have Downs. So in an individual, if there is any red alert depending on the dual marker report or on a history, a better screening test may be advised, which is NIPT, non-invasive prenatal testing. In this test, mother's blood is taken and through this blood the baby's genes are testing. The test is more than 99% accurate for Down syndrome. So yes, it is an important test and depending on the history or individual case, the test can be advised. How long should you take low molecular weight heparin injections? History of 2 miscarriages with unexplained reasons. Um, okay, so Paramjit, basically, if the cause of the miscarriages is unexplained, then the injections are being given on an empirical basis. Your doctor may choose to continue them till 36 weeks also, or just prior to your delivery also. Okay. What should I know if I want a VBAC? VBAC is vaginal birth after cesarean section. Okay. So VBAC, once you have had a cesarean section, it is not that you cannot have a normal delivery, but the candidate for normal delivery has to be meticulously chosen after understanding the pros and cons of VBAC after detailed discussion with your doctor. So you have to understand the advantages of the VBAC, you have to understand the disadvantages of the VBAC, and then only decide whether you really want it or you don't want it. What symptoms are normal and what's an emergency? As we are talking of early pregnancy today, we have just discussed it. Apart from that, bleeding at any point of time in pregnancy cannot be taken as normal. After 26-28 weeks, if you are having bleeding, any watery discharge, any gush of water, any decreased fetal movement, any pain abdomen which is intermittent in nature, coming and going, they are not normal. Okay. Do we have any more queries? So I think that was it. Hope you all found this session useful, and please you can message if you have any more queries. We'll try to answer that later. Thank you on behalf of Cloud9 team. Thank you. Thank you again.